Welcome to Real Talk with Roberta's House. Today we're going beyond the numbers and the headlines to talk about the real people and the heart of the opioid crisis. Behind every statistic is a life lost, a family grieving, and a community trying to heal. In this episode, Beyond the Numbers, Grief, Recovery, and the Human Cost of the Opioid Crisis, we're joined by community partners working at the system level, along with a member of Roberta's House team who brings lived experience to this conversation. Together, we talk honestly about loss, recovery, and what healing truly takes. This is a conversation rooted in compassion and accountability, one that centers on the humanity of those we've lost, those in recovery, and the families left behind. It reminds us the real healing happens when we see people, not just problems, and when support continues long after the headlines fade. Welcome, 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 Sarah, Augusta, and Paul. Please introduce yourself and tell us your connection to the opioid crisis. I'll start at this ladies first.
Hi, I'm Augusta Gribbets. I'm the program director in the Mayor's Office of Overdose Response. My job primarily is in charge of overseeing all the grants that come out of the Opioid Restitution Fund and supporting the city's strategy to address the overdose crisis. Thanks for having us.
And I'm Sarah Whaley. I'm the Executive Director of the Mayor's Office of Overdose Response, and I have the pleasure of working with Augusta and Roberta's House. Through our office, the Mayor has charged us with coordinating the city's response to the overdose crisis and overseeing the Opioid Restitution Fund.
Oh, thank you, Paul.
Hey, my name is Paul, and I'm an internship here at Roberta's House, and I've experienced opioid addiction, and I know the results, and I know the recovery basis behind this problem. So I'm a living testimony that recovery does work.
All right, then, all right, then. So I'm going to start with you ladies over here. From an RF perspective, how would you describe the current impact of opioid-related deaths on Baltimore families and communities?
So I'll start just by talking about our current numbers. So we are seeing historic downward trends in overdose deaths in the city, which is, we're hopeful about that. However, the numbers in Baltimore are still quite high. I think the preliminary numbers for 2025 are still, I think they're at about 500 individuals. When we talk about the real impact that has on the city, our communities, and our families, looking just at numbers for a single year, I think is short-sighted, because when we lose the life of someone, that impacts the community, that family for a long time. So I think looking historically at where Baltimore has been with the overdose crisis and how high the amount of loss that this city has seen, I think we still have a lot of work to do.
Okay. Augusta, you have any thoughts about how it's affecting the families and the communities?
I think substance use is a complicated issue that touches as Sarah talked about, not just the individual, but the community, the neighborhood, the family. And it is impacted by all the social determinants of health that are available to folks, so such as housing, transportation, food access. And so I think when we really look at the overdose crisis in the city, it's one about the lives that are lost, but also about the system that's at play and contributing to the crisis.
Makes a lot of sense. Thank you so much. Paul, I want to go to you because I think that one of the things that I really want to address is this whole concept and idea of stigma. So how does stigma around addiction, overdose, and recovery show up in real ways for individuals and families?
Well, a lot of times, people think that substance abuse is a choice, what it is, and we was looked down, we was frowned upon. I myself wasn't brought up that way, but in all actuality, substance addiction it's a disease.
Mm-hmm.
It's a disease because it's chronic and it's progressive, and it needs treatment in order to be cured. And recovery, like I just stated, recovery starts within the individual. So just because a person may be suffer from opioid addiction doesn't mean make them a bad person at all.
I think it's so important because I think that we have changed some of our thoughts over the past decades. When I first started out as a physician almost 30 years ago, um, we were actually penalizing people who were substance users and did not appreciate the fact that it was a disease process, right? Just like diabetes or anything else, right? And so it's really important now that we understand that this is a disease process, right? Like any other disease. And I tell people all the time, when I used to work in the emergency room as a resident, if somebody was in a methadone program and they came into the emergency room having taken some heroin on the street, to a certain degree, we would call the um, program and they would actually reduce the amount of methadone a person was on, which made no sense. And I would always say, you know what, if I was a hypertensive, diabetic, obese person, and I decided to have a 2-old beef patty, special sauce, lettuce, cheese, pickles, onions on a sesame seed bun,
The side of a cookie.
and a Diet Coke. And then 3 hours later, I'm in the emergency room because I have a high sugar. No one would ever think not to give me additional insulin. But it's the same practice, right? It's the same thought. It is a disease. So, Paul, if you're comfortable in sharing, what did support or the absence of support look like during your journey of recovery?
Well, support was huge. I mean, I had my family, my mother, my father. I got 6 brothers, and they was all behind me, and that gave me the desire to want to do better. And also, I was brought up in a Christian home, and I know biblical principles, and I thought I applied them to my life, but once I got out in the streets on my own, you know, something different took place. I wanted to fit in, I wanted to be a part of. So support is very important. And I think that if each and every person that stereotypes drug addiction, if they would understand the concept, what this really is, and not look down or frown upon it, then maybe more people will be willing to recover or go somewhere to get better.
I think it's really important because I think one of the things that we do have with the stigma is the fact that many people don't want to have like a recovery program in their neighborhood, things like that, right? And I always say that it is very apparent that the substance use issue is not only in our neighborhoods. For some of us, it's in our front yards. For some of us, it's in our backyards. For some of us, it's in our living room. And for many, it's in our bedroom, right? So it's here. And so we need to have those types of things. We talk about opioid restitution funds. Sarah, would you mind explaining what are those opioid restitution funds and things like that? And then Augusto or somebody can actually explain how do we look at equity as related to those funds. So let's kind of start with what are those funds?
Yeah, so the opioid restitution funds here in Baltimore are the proceeds that the city has won from litigation or lawsuits that they brought against companies that are part of the opioid industry. So these are the manufacturers, the distributors, the pharmacies, and they were sued for their role in perpetuating the overdose crisis here in Baltimore and across the country. And so cities, states, counties across the country brought these lawsuits against the companies, and many of those jurisdictions got together. And so there's national litigation. Baltimore was working with those folks as well, but then when we saw the portion that the city would receive from those settlements, it paled in comparison to the impact that we were seeing here in the city. So Baltimore continued those lawsuits on their own. They didn't sign on to the national settlements. So many of our cases were negotiated for settlement with just the city, and then some of those actually went to trial. So the opioid restitution funds there's also a fund, a specific fund. So all of those proceeds go into this dedicated account where all of the city's proceeds are. And so that's what we call our opioid restitution fund.
Okay then. So how, if at all, did we take into account the equity issue as it related to those funds?
So I can really speak to the process of distributing those funds, really couched within a very thoughtful and thorough strategic plan that the city has recently completed. When the mayor signed his executive order establishing the opioid restitution fund, part of that executive order was putting out a needs assessment and a strategic plan every 2 years. And that needs assessment is about collecting both qualitative and quantitative data, looking at the impact of the overdose crisis throughout the city, hearing from people with lived and living experience, providers on the front lines, hospital systems, family members, community-based organizations, and then also looking at the data that Sarah talks about in the beginning of the podcast and compiling all that into a needs assessment. And then based off that needs assessment, really looking at the city's key priorities. What is the data telling us? So what are the priorities that the city has to address in order to address the overdose crisis, and kind of compiling those down into strategies and priorities. And all of that, that whole strategic plan and needs assessment is really the overarching approach is based in equity. And really, I think a part of our opioid restitution fund is we have a restitution advisory board that was really very, very important in setting out what those strategic priorities were and identifying key priorities to fund through a recently released community grant that came out. So it's a very iterative process, but both based in what the data we see every day and also people's everyday experiences with the overdose crisis.
Well, this is wonderful. I'm so glad we're having this conversation. We're going to get ready to take a break. And after our break, we'll come back. We'll talk about what are some of the things that the Opioid Restitution Funds has funded, including Roberta's House, right? And we'll also talk about some of the grief as it intersects when it comes to grief and recovery. Okay?
My sister, she was always the one showing me how to do things. She ran behind me when I learned how to ride a bike. When I didn't understand my homework, she'd sit right there with me. My sister was always making sure I was prepared. She showed me how to tie a tie. I just don't think she could have prepared me for this.
If opioid loss has touched your family, your story belongs here. Grief from overdose doesn't look one way, and neither does healing. At Roberta's House, no one has to explain their pain to be understood.
Welcome back to Real Talk with Roberta's House. This is the episode Beyond the Numbers, Grief, Recovery, and the Human Cost of Opioid Crisis. We were talking about these opioid restitution funds and stuff like that. It's wonderful that we're able to get these funds. Can you please kind of describe some of the different programs or some of the different areas by which we have placed those funds? And then maybe, okay, so you could talk about some of the barriers that we're still having despite those funds.
So in many of the settlements, the attorneys negotiated some conditions of those settlements. And in many of them, there were earmarks for specific organizations. So we could get that money out into the community quickly. And so the city has been working with those organizations. There's 22 of them. And that total earmarked amount is $87 million. So we've been working with those organizations to sign formal grant agreements so they can get their earmarked funds. Those grant agreements were really framed around the needs assessment and strategic plan that Augusta mentioned. And there's 5 key priority areas there. So again, we looked at what the approved uses were for those funds. So approved uses are for programs, supports, initiatives that address the 5 areas, which are recovery, harm reduction, treatment, prevention, and the social determinants of health. But then that are also related to our strategic plan, where we have priority areas around addressing disparities, addressing stigma, which we talked about, reducing silos, improving access to care, and improving the quality of services in the city. And so the funding is really going to address those like 5 buckets while addressing the 5 priority areas. And how we looked at that was I'll use the disparities as an example. So we know there are populations that are more impacted in the city than others. And so our numbers right now, Black men over the age of 55 are experiencing fatal overdoses at a higher rate than other folks in the city. We also see other trends where in the state of Maryland, one of the leading causes of maternal mortality or fatality deaths for people who are pregnant or parenting is opioid overdose. And so looking at those specific populations and what programs are helping support those individuals, there's also geographic disparities. So there's some neighborhoods in the city that are impacted more than others. Some of those neighborhoods have a lot of programs and some don't have any supports at all. So in thinking about how we were funding organizations, we looked at some of the needs that we were seeing and making sure that those programs address those needs, either for population or geographic disparities.
Makes a whole lot of sense. So tell me a little bit about some of the barriers that we may be having at this particular time.
Yeah, so I think we spoke earlier about how significant this crisis is and how this crisis did not start yesterday. It's been decades and decades of ongoing issues related to overdose and substance use and inequity related to care. So I think a significant barrier is lack of funding, even though we've received a significant portion, and we're very, very, very pleased to have such a significant amount of money from the Opioid Restitution Fund. It's not enough to address a decades and decades worth of an issue. And we know, as I spoke earlier, we can't tackle this issue by only looking at a singular service for someone to address substance use, just treatment per se. We need to look at it from a comprehensive approach of housing, the neighborhood, access to ongoing health care, family support. So I think it's really looking at what the opportunity and also the funding needed to address the problem is, I think, a constant barrier to.
Yeah, sure. You know, it's very interesting because now that we're seeing the funding is coming out, we understand that we have an issue. One of the areas that I thought was not really being addressed was the whole idea of the grief of the people who are left behind, the grief of the community, right? We have people who are dying every day, potentially because of the opioid crisis. And so I was very, very pleased that Roberta's House was able to receive some of those fundings to actually deal with some of those issues. Now, Paul, I know that you've been there, you have lived experience with that, and you're now at Roberta's House. So, Paul, from your perspective, let's talk a little bit about grief in the recovery phase, right? How does the recovery phase affect the grief? Or how does grief affect the recovery phase? Like it's kind of like one of those types of things. What comes first, the chicken or the egg, right? And what have you learned since being here as a part of Roberta's House family?
Well, one thing's for sure, and two things for certain that, grief doesn't exonerate from or exempt itself from anybody. And I'm gonna speak for myself. An example, even when I was around recovery, I experienced grief. I experienced the loss of my mother, the loss of my father, and that was traumatizing to me. I was a deep sorrow, and see, some of these things can trigger relapse. Deep sorrow, grief can trigger relapse if it's not addressed appropriately. One thing I've learned how was to develop coping strategies and coping mechanisms to deal with grief, because every day we can experience grief. Grief doesn't have to come from the loss or of a person. It could be a loss from a job. It could be a loss of friendship. Grief is loss. And it can affect a person in recovery in numerous ways. It could be positive or negative. That's why it's important to have these skills to deal with and to overcome, grief when that time comes, because it's going to come, and
Mhm.
you got to be prepared for it.
Amen. Thank you for that. I always appreciate someone with lived experience because they can actually tell us and be a straight shooter about it, which is really, really wonderful. I'm going to end this particular portion right now, but I do want to come back and talk a little bit more about some of the funding that we have and what we're able to do with that. And I do want to talk about what you describe as hope as you see it for folks who are in recovery
Mhm.
at this particular time. And we can talk a little bit more about Roberta's house. Now, with the plan,
Yes, sounds like
we'll see you in a moment. Welcome back to Real Talk with Roberta's House. This is a wonderful, wonderful conversation. This is the episode of Beyond the Numbers, Grief, Recovery, and the Human Cost of the Opioid Crisis. So, Sarah, we talk a lot about all the things that we're doing, right? But what does true success really look like? What is that overall vision that we can say that we've really made a difference in the lives of the people that we serve when we're talking about the harms that were caused by opioid crisis? What are your thoughts on that?
So I will admit, this is a confession, I'm an academic previously before joining city government. So I think we look a lot to like the quantitative number for success. I think that's one piece of it. So obviously we want overdose rates to decrease. We want individuals who have substance use disorders connected to treatment. We want treatment retention to increase. But I think real success looks like some of the things that Augusta discussed. We often see substance use as the problem, but I believe that substance use is a symptom of bigger problems. So real success looks like addressing the real problems, not just sticking a Band-Aid on an individual or community. It's really addressing and redressing those historic harms. It's making sure people have a good quality of life here in Baltimore City, that people have access to safe and affordable housing, that people have a warm meal, that people feel a sense of dignity when they wake up every day. I think that's real success, and that's how we'll know we've done a good job with this work. And that's harder than just one single number, but the city, the mayor, the administration is really committed to thinking systemically about this issue and doing the things that we need to do to address that.
Makes a lot of sense. So we need to understand the underlying diagnosis and treat that, as opposed to just kind of picking off and trying to keep treating different symptoms, different symptoms.
We've got to get to like that root cause.
Or the root causes.
Causes,
right?
yeah.
That makes a lot of sense. Because obviously there's a whole lot of root causes that are there, right? So we're having this conversation. Different people are listening to us and all that kind of stuff. So I guess I would ask, what can listeners who are community members, employers, faith leaders, policymakers, what could they do differently after hearing what we
I think it goes back to your earlier question around stigma and what Paul talked about. I think on an individual level, like as Sarah talked about, this is a system level issue, and there are deep root causes that are not going to necessarily be immediately solved by individual action. But I think the power of an individual is to really understand the stigma that one carries around substance use disorder, around people who use drugs, and to spend a lot of time undoing what that stigma looks like and feels like in you, to use language that's person first, to welcome people without limitations around their use or their pre-existing conditions. It's really about being person-centered, and I think that can look and feel very different, but I think centering that constant kind of approach in everything that community members, community-based organizations, service providers, faith leaders are doing is welcoming people and how they show up and treating them with humanity and dignity.
Amen. That sounds wonderful.
Can I add to
Go ahead.
that?
Please
Just
do.
want to add some actionable things that people can do. So I think making sure that you're trained in naloxone and overdose reversal. Living in Baltimore City means that this crisis is, like you said, at our doorstep, inside our home. And something that we saw early on in looking at the data is that the majority of fatalities in the city actually happen in that decedent's home. So that person that passed away, they passed away in their home. This crisis is everywhere, and when we see it out on the street, that's where we think it is. But if people are passing away at home, we need to have naloxone in home, right? So I think getting trained in naloxone starts at the individual level. For community, we launched a program called Naloxone Neighbors. So if I'm gonna look in the camera, if there are community leaders, community association presidents that are interested in being part of this new initiative, so you can get training for naloxone into your community, we're really excited to launch this initiative. So please reach out to overdose response at baltimorecity.gov, and we would love to have you involved in that initiative.
Okay, I want you to repeat that again. Look them dead in their eyes, and I want you to say it to them straight on out. Go
If
ahead.
community leaders are interested in being part of the Naloxone Neighbors Initiative, which gets training in naloxone directly into your neighborhood and your community, please reach out to us at overdose response at baltimorecity.gov.
From Sarah's lips to God's ears. I think that is wonderful.
That
and that
was-
is something that we really, really, really would like to be able to let people know about. Naloxone is so important. Since we've been actually having these programs for years now, right? I can tell you that personally, I have administered naloxone at least once or twice per year since its inception, and have saved people's lives. And so it is so very, very important to be able to save a life, because that gives them another opportunity to continue to heal from their disease. Paul, I'm coming to you. What does hope look like for you? Hope as it relates to this opioid crisis from a personal perspective, and also as a member of Roberta's House right now.
Well, hope to me is that more and more people are, now I don't like to say word, individuals are realizing that this opioid crisis is serious. And more people, individuals, are joining the fight against this opioid crisis. There's plenty of resources available for those who want help. So there's programs available. It all starts within the individual. You know, the individual gotta want the help that's provided, because it's not like we working with nothing. We work with a lot. And I like here at Roberta's House because just about at every station there's an emergency kit that has Narcan. You know, and we have a lot of individuals that come through here that's suffer from, that's grieving because of a loss from substance abuse. So that's very important to have these stations there, because you never know, even walking up down these streets, individuals are getting high and somebody can fall out at any time. And we are equipped here to be there in a time, like you said, I'm able to administer Narcan to somebody, it was 2 years ago. And this person would have died if it wasn't for the Narcan.
Amen.
You know, and able to administer that, and you have to be taught how to use it, is a big help.
Well, thank you guys so much. I guess what I'd like to say that Roberta's House is a family grief center.
Yes.
We are here to help families and individuals along, because they're grieving because of a loss, and many times it's a loss of somebody who has an overdose of opioids, and they'll come in and they won't say that because of the stigma. But as time goes on, they will let us know, and we've come to realize that many of them are suffering from that grief, which is a slightly different grief because of the stigma that it has from society. They're bearing a lot more weight and pressure on their shoulders, but we're here to help them. We also provide Narcan here at Roberta's house. We provide the teachings here at Roberta's house. And so if anybody would like to get more information about the Narcan and harm reduction, we provide that education here. And if anybody is grieving, especially if it happens to be related to opioids, we are here for you. And so what I can say to you is you can always call Roberta's house at 410-235-6633. I'm going to repeat that, 410-235-6633. Or you can look us up on the internet, www.robertashouse.org, www.robertashouse.org. I want to take this opportunity to thank my guests on today. I appreciate you guys coming, and I want everybody to remember Real Talk with Roberta's House. God bless.
God bless.